Hi Edgar, I'm Dr.V consultant pulmonary medicine at Yashoda Hospital, United City. On November, every month is celebrated as a COPD Awareness Month, and November 19th is the COPD Day for 2025. So this month we should know certain facts and certain myths about COPD. COPD is a disease which is seen only in smokers. This is a myth. Hmm? So in India, though smoking remains a cause of COPD, there are a lot of diseases other than smoking which can cause COPD. This is called as non-smoking COPD. In fact, I would say 50% of COPD in India is non-smoking COPD. So what other diseases can lead to COPD, or what are the risk factors for COPD? So first in India is the outdoor air pollution. So as we all know, in a lot of metro cities, there is increasing air pollution, and if you live in those cities over several decades, you can develop COPD. Second is indoor air pollution or biomass exposure. In several villages, till a few years ago, many women used to cook in chulas. So that smoke also can lead to COPD. Third is occupational COPD. Even today, there are several occupations where there is exposure to dust. Mining, sandblasting industries, farming, especially cotton farming, and certain occupations like the traffic policemen where they stay outside. So any occupation, if there is dust exposure and they stay in the occupation for 10 years, it can also lead to occupational COPD. Fourth is a very important cause called as post-TB COPD. So many people after tuberculosis infection develop a disease very similar to COPD. Fifth is post-asthma COPD. So if an asthmatic person, the asthma is not controlled well, that also can lead to COPD. And lastly, a small group of genetic COPD because of genetic problems. So other than smoking, we should remember that there are a lot of occupations, lot of environmental reasons and genetic reasons why a person can develop COPD. Breathlessness is common with aging. So this again is a myth. Every day we see several elder men and women who come and say that I am breathless, but I think this is because of my age. I think again this is something which you should understand that it is not correct. So pure aging will not lead to breathlessness. So if there is breathlessness, irrespective of your age, there should be some reason behind the breathlessness and we should look for it. And one of the important causes of breathlessness in elder people is COPD. In fact, the theme for this year's World COPD Day also is, if you have breathlessness, think COPD. So if you do not think that COPD could be a cause of breathlessness, you would not diagnose it early, and then there will be problems later on. So breathlessness cannot be because of aging alone. Always there will be a disease, and COPD can be your cause of breathlessness. COPD is a curable disease. We can treat COPD. So again, I would say, unfortunately, this is a myth. So this is one disease where there is no cure. So COPD by medical definition is irreversible damage to the lungs for whatever reason it is. So once you develop COPD, there is nothing you can do to reverse the disease. You can only give medicines to control the disease and to prevent it from progression. So COPD is one disease where I could strongly tell prevention is better than cure. So we should always avoid all the things which lead to COPD, smoking, dust exposure, occupational dust, biomass and everything, because once we label a person as COPD, then you will be COPD for life. You can only control the disease. So COPD is one disease where there is no cure. COPD is a disease which only affects the lungs. So this again is a myth. So though COPD is a disease of the lungs, the impact of COPD extends over the entire body. In fact, COPD as per the current guidelines is considered to be a systemic disease, which means all the organs can be affected. So what are the other impacts of COPD? One is muscle loss. If you see, most people of COPD will have a lot of muscle loss and weakness. Second is osteoporosis, which means the bone density becomes lesser in people with COPD. Third is the impact of COPD on the brain. So people with COPD usually have a lot of anxiety and depression. Fourth is the close interrelation between COPD and the heart. So many patients with COPD also have cardiac problems, heart failure, heart rhythm problems, heart increase in heart pressure. This could be directly because of COPD or because of the common risk factors. So whenever a patient of COPD goes to the hospital or comes to us, we should also address these other manifestations in muscle loss, the bone weakness, the emotional comfort of COPD, and the cardiac issues with COPD. So COPD is not only a lung disease, it's a disease of the entire body. Once inhalers stop working, then there is no hope for me. So this again is a myth now, because inhalers are the mainstay of treatment for COPD. So every person of COPD will be on inhalers. But what if the inhalers themselves are not able to make the person better? So don't you have any other option? So in COPD now we have a lot of other treatments which are there. Some of them I will just list. One is called as pulmonary rehabilitation. So a lot of exercises, lung strengthening exercises can be done to make the life of a person better. Two, we have certain medicines called as biologics which can be given to make a person better. Three, you have certain bronchoscopic treatments, endoscopic treatments called as lung volume reduction surgeries, which again can help the person live better. And lastly, if it is very, very severe in India, now we have lung transplantation which can be done in young people with COPD, and again they can have a new life. So even when inhalers stop working, you have a lot of newer options which we can do, which we can give you to make your life better, to make you breathe better. COPD is a disease which can be prevented. So this is a fact. So in fact, I would again say that in COPD, prevention is better than cure. So all the causes of COPD are the causes which can be prevented. Smoking, the most important cause of COPD, is a preventable thing. So people should not smoke. Occupational COPD, all the factories where there is lot of dust exposure, the people who are working in the factory have to wear a mask and have to undergo annual health checkup, and then we can prevent COPD. Third, air pollution. Again, to an extent, is preventable. So we should make sure to keep our environment healthy and breathe healthier air. Fourth, asthma. As the long-standing asthma as a cause of COPD, again is preventable, because if you treat asthma correctly, the person won't develop into COPD. So most of the causes of COPD can be prevented, and I would strongly say that it is better to prevent COPD than to treat COPD. Early diagnosis will change the outcome of disease. Again, this is very, very true for COPD. Just like in lung cancer, earlier you diagnose, the better you treat. Same is true for COPD. The earlier you pick up COPD, we can start giving medicines and we can prevent the progression of COPD. So, the important thing which people have to realize is, do not neglect your symptoms. Breathlessness, which is persisting for more than 2 weeks or 3 weeks, cough which is persisting for beyond 2 to 3 weeks, always go to a doctor. Think of COPD. If you have any risk factors for COPD, get yourself tested. And early diagnosis. You get your diagnosis established and then start correct medicines, then your quality of life will be much better. Spirometry is the test of choice for diagnosing COPD. Again, this is a fact. So whenever we have a patient or a person who comes with symptoms of COPD, what should you do? So the two things which we always ask are X-ray and a spirometry. I think this is something which even people should ask for if you have breathlessness or a cough which is not going down. and COPD is diagnosed by spirometry. Spirometry is a very simple test. You just have to blow into a machine. You have to blow for 6 seconds and then you know your lung function. So if your lung function is lower, there are certain criteria and then a doctor can diagnose you with COPD and then give medicines appropriately. You should not be worried, but you should be happy if you can diagnose the disease early and then start treatment better. So the test of choice for diagnosing COPD is a spirometry. Inhalers are the backbone of therapy in COPD. Again, this is a fact. I think this is something which people have to understand, that for COPD, the main medicine is an inhaler. It is not a tablet. So medicines which we inhale through the mouth are the ones which are recommended for every person diagnosed with COPD. There are several types of inhalers. So which inhaler will best suit you will be decided by your doctor. But every person with COPD has to be on regular inhalers. Not only when they have symptoms, but they have to take regular inhalers so that their symptoms will become better, the lung function will stabilize, and their survival will become better. So inhalers are the mainstay of therapy for COPD. This is something which every person living with COPD has to realize, that inhalers are the first line of treatment for COPD. Lifestyle modification is as important as taking medicines. Again, this is a very important thing for people living with COPD. You take your inhaler, but you also have to do some lifestyle modifications like regular exercise. So this is a very important part called as pulmonary rehabilitation, and this actually improves your life expectancy. You will live longer if you exercise. Second is good nutrition. So improve your protein intake so that your muscle strength will improve, and again that will lead to longer, better life expectancy. Third is vaccination. All patients of COPD have to be vaccinated to certain common infections like influenza and pneumonia, and this is something which has to be done. And fourth is to live a stress-free life, because emotions, anxiety again can lead to poor outcomes. So other than inhalers, lifestyle modifications are also very, very important for managing person with COPD. So on this occasion of the World COPD Day and the COPD Awareness Month, I think all of us, both the people of India as well as the doctors, should know what is new in managing COPD. So I will tell 4 things which have been introduced and have changed the way we treat people of COPD. One is a new group of inhalers called as SITT, single inhaler triple therapy. So whenever we treat people of COPD, earlier we used to give 2 different inhalers or 3 different inhalers, but now the new inhalers, all the 3 medicines are clubbed into one and then given to the patient. So for the patient, it is much easy because they just have to take 1 inhaler once a day or twice a day. And this has been shown to actually improve the survival. So the new thing is SITT, called as single inhaler triple therapy. The second thing, which again is going to change the way we treat people of COPD, is medicines called biologics. So now this year, one biologic has been approved called as Tupilumab. Unfortunately, you don't have in India. But next year, another biologic will be approved called as Vipolizumab, and then so on and so forth. So now, from this year onwards, we have biologics. These are injections which are given once a month or once in 2 weeks. And then they improve the breathlessness for people who have severe COPD. So this is again something which is new and which will help people of COPD breathe better. The third thing again, which is relatively new, is something called as lung volume reduction. It's called as bronchoscopy lung volume reduction. So this has been there in India for the last few years. In India, we do a procedure called as BTBA, called as thermal vapor ablation. So this is done for people with severe COPD, where they're not able to breathe better, they're using inhalers, still not feeling happy. Then we put a small scope inside, and then whichever is the diseased part of the lung, we will ablate it. And then the normal lung will function better, and then they can actually breathe better. So over the last years, we have treated several people with BTDA, and then now they are very happy and they are walking and they're doing other activities. The last thing, again, fourth one, which again in India is relatively new, is something called as lung transplantation. In the last few years, several centers across India have started offering lung transplantation services. So which means if a person's COPD is so bad that nothing is working, now you have the option of taking out your lungs and putting in a healthier lungs. So this is not for everybody. This is only for very select severe. But yes, this is there in our country. So now in India, we have 4 new options called as the newer inhalers, the biologics, which are injections, the procedures called as lung volume induction procedures, and lung transplantation. So with these, I think our aim is to help all patients of COPD live a comfortable and easy breathing life.